I'm Steve Adubato. We'll be talking about cancer care, new treatments in cancer care with two people who live it every day, who are helping people every day. They are, in fact, Dr. William DeRosa, Chief of Oncology, and Dr. Molly Gabel, Medical Director of Radiation Oncology, both joining us from Summit Medical Group, MD Anderson Cancer Center. I want to thank you both for joining us.
Thank you.
Thank you for having us.
Dr. DeRosa, let me ask you, cancer care today, how much different than 5 years ago, 10 years ago?
Oh, it's dramatically different. We have departed what would be called the phenomenologic era of cancer care.
The what?
I would say the phenomenologic, where we did a treatment, we did a prospective randomized study, and then we looked to see and compared, and then figured out what to do from there. That was basically an inferential approach, where we inferred what the biology was. We have rapidly basically gone into what would now be considered the biological basis for figuring out what to do, understanding the circuitry, exactly what is wrong at the cellular level. So now, because we're becoming rapidly very sophisticated by being able to do genomic testing, we can then figure out where and exploit the vulnerability or whatever the target is that has caused the cancer.
Doctor, what does it mean for patients?
It means, which we love, it means that they can be promised the same cure, but with less side effects, and able to live their life to the fullest, including during treatment. And so in my field in radiation oncology, it's changed in terms of technology, but now we're focusing on how do we get that same cure with many less side effects.
Talk to us about this connection with Summit Medical Group. By the way, Summit Medical Group is one of the underwriters of what we do in terms of our healthcare programming, but the whole MD Anderson Cancer Center, explain the connection, the correlation.
Sure, it's very unique. MD Anderson desires to have their brand of care.
Who is MD Anderson, and why do they have the reputation they do?
Well, MD Anderson is considered the #1 comprehensive cancer center basically in the country by U.S. News & World Report. And
so I want to be clear, because public broadcasting, you have to cite the source. That comes from U.S. News & World Report?
That comes from U.S. News & World Report, that's correct. And they're considered the #1 research institution in the country for cancer. So they desire to bring their brand of care to at least 1/3 of the population. So they've entered into very novel partnerships, predominantly with health systems. We're the only physician-owned and governed entity that basically, because we're essentially an ambulatory organized care delivery system that's physician-owned and governed. So it's unique in that regard, but we're still a full partner. So we intend to leverage their intellectual architecture, how they care for their patients, and bring that exactly to where our patients live.
Let's talk about this, Dr. Gabel. I'm curious about the whole clinical trial issue. How have they changed, and why does that matter? What is a clinical trial, by the way?
So a clinical trial, there are many types, but a clinical trial is the way that we prove that treatment X is better than treatment Y. And that can be with drugs, which is in his specialty, or techniques with radiation, or the outcome of the patient. And we're very interested in patient-reported outcomes. How did you feel? How do you feel 10 years after treatment? So clinical trials, as Dr. DeRosa alluded to earlier, we're really getting to what's called precision medicine, or what genetic hit. What is wrong with that cancer cell that we can take advantage of and kill it faster? But we're also looking at more customized treatments. So again, the patient is not only cured, but with no side effects.
How has radiation oncology changed specifically?
It has changed mostly in terms of technology and information technology specifically. So when I started 25 years ago, we had very good treatments, but now we can literally pinpoint the tumor. We can follow the tumor and turn the radiation on and off when a patient breathes or moves, normal bowel function moving. So I'm thrilled to be in this era where we really can focus the radiation.
Doctor, let me ask you, the whole physician-patient relationship as it relates to cancer care, do you think it's how is it different than the important physician-patient relationship for a patient without, or not dealing with cancer? How is it different?
Well, I've always felt that oncology is the last frontier of medicine.
The last frontier?
The last frontier.
Of course.
Well, because of the fact that, as I said before, people are very sick. We've made a lot of advances in a lot of other disease sites, but cancer goes across all organ systems. Cancer can involve any organ, and so in that regard, in terms of the science too, it's actually breathtaking to see what's happened over the last 30 years, and to now be at the threshold where we can interrogate the tumor, we can find out what the driver mutation is, and we can actually target it and drug it.
Yeah, but the whole beyond the clinical side of it, I am interested in the emotional and psychological side. How does it change the role, or what impact does it have on the role of the physician?
I would say that I've been doing this for 30 years. It's been my great privilege to do this for 30 years. And I think that the relationship, the human aspect of what we do is something that is timeless. And I treat my patients the same way as I did before. We try to do the absolute best we can for them. We try to always be there for them. They're always facing an incredibly challenging situation. So that aspect, the human aspect of it, I don't know if that's changed. But what's so wonderful is that now we're able to offer things and more hope. And so what we're able to do is turn diseases that were universally fatal within a very short period of time into chronic diseases.
One last question for you, Dr. Gabel. Someone says, I have to leave New Jersey to get the best cancer care, you say?
One of the reasons why I chose my job with MD Anderson is because I knew it would be a way to guarantee quality, the same quality.
No matter where you live?
Yes.
No matter what your zip code?
Yes. We mean it and we live it. I mean, it's real.
Yeah. Dr. DeRosa, Dr. Gabel, we thank you very much for joining us. There are so many, I can't even think of anyone watching right now who either hasn't personally been touched or have a family member, which is personal, very personal, human, touched by cancer. We can't thank you enough. Appreciate it.
Thank you so much.
Thanks for having us.
We'll be right back right after this.
The preceding program has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of Caucus New Jersey has been provided by Horizon Blue Cross Blue Shield of New Jersey, Valley National Bank, Caldwell University, New Jersey Sharing Network, Adler Aphasia Center, the New Jersey Office of the Insurance Fraud Prosecutor, and by Kessler Foundation. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus New Jersey has been produced in partnership with TriStar Studios.